My name is Judy DeSouza, and I'm from Connecticut. I'm here to talk about my daughter, Bryanna. She was my only child. At her birth, she was born with jaundice and an enlarged liver. The neonatologist cautioned it might be something more, but her growth seemed normal. She met all her milestones. It would not be until she was 9 years old that she would be diagnosed with Niemann-Pick Type C. My daughter was such a joy. She was very sociable and loved to sing and dance. Symptoms of the disease began for her at 2nd grade. Her handwriting started to become illegible. Her running seemed awkward, and she would fall down when laughing. Her speech started to slow down. She was asked by some of the kids, why did she talk so funny? She would ask me why she had to be so different. When we learned she had NPC, I, as her mother, felt relieved and glad to have finally been given a diagnosis of what she had. We had gone so long without knowing what it was. I totally did not give much thought to the doctor's words of no cure because I suddenly had hope that this disease had a name, that there was a foundation of people to connect with, doctors and researchers working on a cure. Her father, on the other hand, was upset and said, what is there to be happy about? There is no cure. The loss of hope would not hit me for several years. As Bryanna's ability to eat, walk, talk began to decline, I had to learn to let people help me. By the time she was 6 years old, her dad and I were no longer together, and she lived with me. I had to hire a live-in caregiver 5 days a week to assist me with Bryanna, to get her off and on the special needs school bus, to bathe her, dress her, to tube feed her, to give her routine medicines, etc. When I got home from work, at night and on the weekends, I would take care of Bryanna myself. When Bryanna was in the pool or the beach, she would love to swim around with an inflatable tube. And you could tell she felt normal as much as a normal life we could have. Around the age of 12 years old, when she was no longer able to talk, I would send in notes to her teacher to explain what we did that weekend together. The lack of verbal communication was hard. As Bryanna began to have trouble swallowing, the next step was the feeding tube. Parties were difficult when Bryanna could no longer eat by mouth. It seemed that every celebration involved food and lots of it. As time went on, she would regularly cough up a lot of phlegm, so I would carry a towel with me wherever we would go. She often slept more, which I believe was partly due to medicines, fatigue from a mentally and physically draining of her energy to get through each day's activities, and a lot of depression. She managed to tell me once that she was sad that she could not do anything anymore and that her hopes and dreams were not going to come true. Sadly, Bryanna died in 2006 at the age of 14 years old. To me, the hardest thing is not to have hope. Hope is everything. If there was a potential therapy that could have prolonged her life and given her a good quality life, and it had come in time to help my daughter, this is what I would have wanted. Unfortunately, she declined to the point that as potential therapies were starting to become available, she was not able to take part. I tell Bryanna's story here in the hope that there will be hope available for other children and families affected with the disease now and in the future. Thank you for listening.